What if the foods you eat every day were considered unsafe elsewhere? Across the world, common American staples, from brightly colored cereals to everyday bread, face bans or strict regulations. These differences aren't accidental. They reveal contrasting attitudes toward health, risk, and science. Exploring these foods uncovers a deeper question. How safe is safe enough when it comes to what we eat? Before I continue, please give this video a thumbs up and share it with your friends, so more people can discover this content. I'm on a mission to hit 1,000 subscribers, so if you haven't already, please subscribe. Every single one counts and helps this channel grow. Food is a reflection of culture, convenience, and regulation. In the United States, a vast and highly industrialized food system prioritizes efficiency, shelf life, and affordability. However, the standards used to regulate food safety differ significantly across the world. Many countries, particularly in Europe, apply a more precautionary approach, restricting ingredients or production methods that are considered potentially harmful, even if scientific evidence is not yet conclusive. As a result, several foods commonly consumed in the United States are banned or tightly regulated elsewhere. Examining these differences reveals not only contrasting regulatory philosophies, but also growing global concern about long-term health impacts. One well-known example is Kraft mac and cheese, a staple in many American households. Its bright orange color comes from artificial dyes such as yellow 5 and yellow 6. While approved in the United States, these additives are restricted or require warning labels in parts of Europe due to studies suggesting a link to hyperactivity in children. Similarly, processed snacks like Ritz crackers have historically contained partially hydrogenated oils, a source of trans fats. These fats are associated with an increased risk of heart disease and have been heavily restricted or banned in several countries. Another category of concern involves processed additives found in everyday products. Coffee creamers, such as Coffee Mate, often contain hydrogenated oils and stabilizers that are more tightly controlled in European markets. These ingredients are scrutinized because of their potential effects on cardiovascular health. In a similar vein, sugary cereals like Fruit Loops rely on artificial colorings that are either limited or require warning labels in the European Union due to concerns about behavioral effects in children. Fresh produce and staple foods are not exempt from these regulatory differences. American apples, for instance, are sometimes treated with diphenylamine to prevent browning during storage. The European Union has banned this chemical over concerns that it may form compounds linked to cancer. Bread, a dietary staple, also differs significantly. Some US producers have used potassium bromate as a dough improver, despite evidence from animal studies suggesting it may cause cancer. This additive has been banned in the UK, the EU, and several other regions. Animal products highlight perhaps the most striking contrasts in food policy. In the United States, certain farming practices involve the use of growth promoters and chemical treatments that are prohibited elsewhere. American pork production, for example, may use ractopamine, a drug designed to promote lean muscle growth. Although approved in the US, it is banned in over 100 countries due to concerns about its effects on human health. Likewise, chicken processed in the United States is often washed in chlorine to reduce bacterial contamination. European regulators reject this practice, arguing that it may mask poor hygiene conditions earlier in the production chain. Farmed salmon also faces scrutiny, as differences in feed, antibiotic use, and synthetic colorants have raised both environmental and health concerns in certain countries. Even soft drinks have not escaped regulatory attention. Certain formulations of Mountain Dew once contained brominated vegetable oil, an additive used to stabilize flavoring. This substance has been banned in countries such as Japan and across the European Union due to concerns about its potential to accumulate in the body and cause adverse health effects. Taken together, these examples illustrate a broader divide in how food safety is approached. The United States generally follows a risk-based model, allowing substances unless they are definitively proven harmful. In contrast, many other countries adopt the precautionary principle, restricting or banning ingredients when there is credible evidence of potential risk. This does not necessarily mean that American foods are unsafe, but it does highlight how different societies balance scientific uncertainty, public health, and industry interests. In an increasingly globalized food market, these differences matter more than ever. They shape international trade, influence consumer perceptions, and raise important questions about what standards should govern the food we eat. Ultimately, the comparison serves as a reminder that safe is not a universal definition, but one shaped by policy, culture, and evolving scientific understanding. If you found this interesting, don't forget to like and share it with others who might be surprised by what's on their plate. Subscribe for more eye-opening insights into food, health, and global differences, and drop a comment below with your thoughts or experiences. Would you still eat these foods, or do you think stricter rules make sense? And are there any other products you think should be added to this list?